Hey guys, it's Dr. Abam here. So, in preparation for your stay on labor and delivery, whether you're coming in expectantly delivering or you're coming in for an induction, I wanted to take you inside to show you some things that you are probably going to encounter during your stay. First up is going to be what we use to help you induce your labor. That can be mechanically, that's something called a Foley balloon or a Cook's catheter. So the Foley balloon is literally like a Foley catheter if you've ever had one in your bladder. However, this goes inside of the cervix. And we can only place the Foley balloon for mechanical dilation of the cervix once you are at least 1 centimeter dilated. So there's a Foley catheter, and there's also something called a Cook's catheter, right? So there's a Cook's catheter as well, okay? So these are the two that we would use on labor and delivery for mechanical dilation of the cervix. There have been so many studies that have been done to kind of help us understand what is the purpose of mechanical dilation and how does it help with labor and delivery. And so your teams will talk to you about the study, talk to you about the success rate, and see if that's something that they're recommending, and if you accept it, because you always have the right to refuse it if you do not want to, right? If you do not want these, okay? So if you can imagine, the cervix is like a donut, okay? We're gonna kind of like imagine it as this, all right? And so we will only be able to use the mechanical tools for dilation in conjunction with the chemical or medication options. So these are your Cytotec, right? Or misoprostol or low-dose Pitocin to kind of help move your labor along or induce your labor if you're in that latent phase of labor when your cervix is at least 1 centimeter dilated. So what does that mean? Your cervix, right, is a donut. If I can get my finger all the way through and I can wiggle it, right, then we know that I can at least get this Foley balloon, because it's at least 1 centimeter, like my finger, in through the cervix, okay? Same thing for the Cook's catheter, right? And so of course, these things look like they're torture devices or they're barbaric, but they're not meant to harm you. They're only meant to help us move our labor along. And so once your team has talked to you about, the pros and the cons of using either the Cook's catheter or the Foley balloon, then they're gonna check your cervix. And if you are a candidate for it, like I said, 1 centimeter dilated, then we're gonna, have you bring your legs, right, in that, butterfly position. The physician or, is going to, or the midwife is going to place their finger in there and then be able to get all the way through the cervix. The other thing I think is very important is that it's important to understand that like the cervix is like I said, it's like a donut, but it's hollow, right? And so the cervix has an internal os and an external os. So sometimes if you've had multiple babies, your external os can be dilated, but your internal os may be closed, right? And so somebody may be able to put their finger in here, but may not be able to get all the way through. And really what's important is that we want an open channel between these whole two places, because the baby's probably sitting over here, right? And that's what we're trying to get to dilate. And so to speak to the Foley balloon specifically, so this is that Foley catheter right here. And so like I said, we will thread it inside of the cervix and leave it inside of the cervix. So if you think about it like that, we will put it inside of the cervix, okay? This end of the catheter right here, of the Foley balloon catheter, it has an inflatable tip, okay? And that tip is inflatable. It allows us to place saline in it. And that saline is what allows us to literally like stretch the cervix open, almost tricking the cervix into thinking that the baby's head is there, so that it eventually accommodates and then relaxes and lets this Foley balloon fall out, okay? Same thing for the Cook's catheter, but the difference between the Foley and the Cook's catheter is the Cook's balloon has actually 2 spots. So it has 2 areas for inflation. So like right here, you see this one and you see this one, but in the Foley balloon, there's just this little one right here, okay? And so when we place the Foley balloon, we're gonna fill this area up with some fluid. Now this is the part in both of these that will cause discomfort. We do not like to tell patients that it's not going to be, uncomfortable. However, each person's pain is very different. And on labor and delivery, we have things that can help for pain management. So it's very important that you express that. And if you're experiencing a lot of discomfort with placement of this, it's important that you let your teams know so that they can help you with some kind of like pain management if you need it. So once this part is inflated with saline in it, then it gets inflated through these areas, okay? And then your nurse is going to put like a lock on this area because we don't want the fluid to be leaking through, okay? Then this gets taped to your thigh on tension, right? Because again, we're trying to simulate that fact that like the baby's head is coming down and allowing for the cervix to mechanically stretch open. Once this thing is let go, right? Once we come and the nurses come and pull on it about about every hour. Gently tug on it to see if the cervix is ready to let it go. From all the studies that we know, on average, this can take about 6 to 12 hours to fall out, right? But for some people, it's different for each person. For some people, it may fall out in 2 hours. For some people, maybe 4 hours. But that maximum time frame that we leave it was about 12 hours, and then we may need to evaluate and see, you know, is it just like, has it fallen out and it's sat in the vagina and it's being like, you know, held tight down there, right, in the vagina? Or do we need to deflate it and kind of like go from there, okay? But we basically then we'll like put this on tension on your thigh and check on it every hour. And once this balloon comes out, it really takes your cervix from about 1 centimeter dilated, so 1 centimeter dilated, to ideally about like 4 or 5 centimeters for some people, right? And from the studies that we know, it can shorten the entirety of that latent labor process by using the mechanical dilation, especially in conjunction with the mesoprostol, because we need regular like contractions and, you know, softening. So we're trying to, you know, efface your cervix, right? That's like, so the cervix is like thick like this, starts out really thick. So we're trying to thin it down, right? This is the effacement piece of things to eventually get it from like thick to thin, like paper thin, okay? Or even like 50%, right? And then eventually we can start continuing like regular labor contractions to move your labor along. Now, when it comes to the Cook's catheter, like I said, the difference between the Foley and the Cook's catheter is that the Cook's catheter has 2 balloons at the end. You know, there's a uterine and a vaginal balloon, okay? And that's what is being shown in the end right here. So you have the U for the uterine balloon, and then you have the V for the vaginal balloon. So once we place it, we place so this is your cervix and you're 1 centimeter dilated. We place it again inside of the uterus, okay, inside of the cervix. And the top balloon goes and it sits a little bit above the internal os, a little bit lower in like the uterine area, and then this lower one right down here sits in the vaginal area, and those ends will get filled up with saline, and it literally will form almost like a compression, right? Like pressing on the cervix to like sandwich it. And literally we do not put any tension on this one because, like, again, it just like sandwiches things, and once it's ready to fall out, it's going to fall out. So that's the Foley catheter versus the Cook's balloon. Let me know which one you had in labor and delivery, which one your doctors have talked to you about, and let's have a chat in the comment section.